Today on Lasting Love Real Talk, we are going to talk about healing trauma, anxiety, and what to do when you're having a panic attack in front of your partner. So we had a big discussion in the Lasting Love movement about if anxiety is a manifestation of trauma. I asked the family, and most people said yes. In my experience, my anxiety is a manifestation of my trauma. So we got to discussing, well, if anxiety is just happening because there's unresolved trauma in your body, and the anxiety is like, okay, come on, there's something wrong with me, like there's something wrong and something needs to be released, and it's just your body yelling at you to release that trauma, well then, can anxiety be healed without medication? Can anxiety be healed just by healing your trauma? And the answer is yes. And there was one comment about, well, no, because anxiety and mental illness is all a chemical imbalance. And that rubbed me the wrong way, because that theory of chemical imbalance is disproven. It just got so out of hand, this theory that isn't even proven. And this whole chemical imbalance theory makes people believe that the only way that they can heal and feel relieved is by taking medication. Now, if you take meds and you're cool with it and it works for you, that's awesome. But if you don't want to be on medication and it makes you feel worse, it makes you feel numb, and you really want to heal your anxiety and trauma without that, then you don't have to take medications. I worked in psychiatric settings for about 8 years, and it killed my soul to see the cocktail of meds that these institutions would give the patients to numb them and to just cover up everything. And so I know that, yeah, meds are helpful when there's a really severe, acute situation where you're contemplating ending your life. I mean, this is the kind of patients that I worked with for many years, but you don't have to do that for long-term. In fact, psychiatric medications aren't meant to be used long-term. Now, I'm not a doctor, so I'm not trying to give medical advice. I feel like I have to say that, but let's really talk about what needs to happen in your body and in your nervous system to heal your anxiety, to be released of your anxiety and your trauma. So I'm going to do a screen share here, and I'm going to hope that this works, because I have a really cool graphic here to show you. Let me know if you see it. It's the window of tolerance, and I'm just going to double check on my phone. Yay. All right, so the answer is yes, we can heal anxiety. But what does that really mean? Like, what does that really mean to be healed of anxiety? So let's first start talking about the window of tolerance. We all have a window of tolerance. It's this calm, cool, regulated place in our bodies. If you think back to maybe being on the beach and the sun is shining and just this amazing breeze and you just feel so chill, like that's a good example of being totally in your window of tolerance. Everything just feels chill. And so we all have this place in our nervous system, this window of tolerance. And that's the place where it feels safe to be in your body. It feels safe to be intimate, to navigate difficult conversations, to just show up unapologetically you in your relationships when you're in your window of tolerance. And then also, by being in that calm, cool state, you can choose your desired response instead of being hijacked by fear, causing you to either be in this reactive and anxious mode or down in this shutdown mode. I don't know if you can see my cursor. And a lot of people think, okay, I just gotta get in my window of tolerance, and if I'm there, everything will be good. But when you have unresolved trauma in your body, your window of tolerance is so small, so that any tiny little triggers will get you, will kick you out of that calm, cool state into an anxious, overreactive state, or into a numbed, frozen, depressed state. Now, when you actually heal your trauma, you release it from your body, you rewire your nervous system, your window of tolerance not only becomes your new baseline, but it's so much bigger. This window is so much bigger, so that even when things feel uncomfortable or difficult situations or emotions come up, you can stay calm, cool, and regulated. You can still choose how you want to respond instead of being controlled by your behaviors and by your emotions. And no matter what comes up in your relationship, it's safe to express yourself. It's safe to be vulnerable, and you don't have to constantly shut down or defend or push away your partner. So what does this have to do with anxiety? Well, if you tend to be really anxious and agitated and often react in anger, and it's like, I can't calm down, then my video might be blocking this, then you are often in the hyper aroused state. And if you're in the hyper aroused state normally, share it in the comments, no shame there. I used to be here too. Now, this is like all the little things annoy you, like the dumbest little things. I'm not calling you dumb, but like, that's kind of what you say in your head. Like, why did I flip out over my partner leaving the cheese on the counter? Like, why am I so anxious that my partner is going out with their friends, and I'm feeling like I'm gonna crawl out of my skin any moment because I can't handle it. This is the hyper arousal state. And there are a few things to really note about this state. Is one, we just talked about the window of tolerance. So you can heal and relieve your anxiety, and not just like for a moment or coping skills that put band-aids on it, but you can actually have a new baseline of being in your nervous system, in your body, without anxiety. I mean, yeah, there's things in life that come up. There's a pandemic that comes up that makes us a little bit more anxious, but generally you're calm. The baseline of being in this hyper arousal state is no longer there. And you may have heard, and you may have been even more frustrated by people saying, well, just meditate, meditate and you'll be calm again. And like, when people told me that, I was like, if one more person tells me that, I'm gonna punch them in the face. That didn't help my hyper arousal state. But you can't just tell yourself to be calm. You can't just repeat affirmations in the moment and be like, all right, just calm down, it's safe. That does not work. Your nervous system, like when you're doing that in the moment and you're trying to tell yourself to calm down, you're talking to the prefrontal cortex of your brain. That has nothing to do with your nervous system. Your nervous system does not understand words. Your nervous system speaks in sensations. That's how we store trauma, right? In smells, in sounds, right? That's why like a loud sound can bring you right back to your trauma. Your nervous system speaks bodily sensations and movement. So how can you try to talk to your nervous system to try to calm down? It just doesn't work. And it certainly doesn't work to try to get yourself from like a hyper aroused state to trying to be still and calm. And that's specifically why I wrote in this graphic you have to be able to decelerate into slow and gentle movement to relax. You can't just stop yourself and be like, okay, right? It doesn't work. And so it's a process of being able to decelerate. Really, that's meaning slowing down, gently expanding your ability to stay in your window of tolerance. Because if you're really anxious and someone's just like, relax, or just slow down, just calm down, that probably makes you more anxious, and it's not going to work. But if you're working in a therapeutic relationship with someone who understands these micro body movements, these micro body signals that are, that you're showing through this hyper aroused state, and we meet you there, and then we help you through movement, modulate that, regulate that, decelerate that, that's an experience of being able to come back into your window of tolerance. And depending on who you are and how you've stored your trauma, that's going to look different. That's going to come out in movement more differently. Some people need to like be more in contact with themselves as they decelerate. Some people need to kind of go out here and then come back slowly. Don't try this at home is what I'm trying to say, because it's not something that is safe to try it on your own. I'm just trying to give you examples of like what might it look like if you were to come into your window of tolerance from a hyper aroused state. And it's really, really important to say that you cannot rewire your nervous system on your own. You cannot heal this trauma on your own, whether, you know, maybe you've tried online courses or you've tried it on your own and it hasn't worked, or it's made you feel worse, or it's made you feel more traumatized. That's not your fault. That's not because you're broken or damaged. It's because it doesn't work to do it on your own, and it's actually dangerous. So this actually needs to happen in a safe therapeutic relationship where someone can help you decelerate and rewire. Just like a baby, a child needs a normal, healthy adult to help this child grow into a normal, healthy adult who knows how to calm themselves down. Now, another member of the Lasting Love movement said, well, what happens, you know, that she asked, what happens if I have a panic attack let me stop sharing, in front of my partner? That's a really vulnerable moment, right? Like your partner doesn't know what's going on, you're feeling really anxious. And she asked, well, how do I calm myself? So as you could see from the window of tolerance graphic, the only way to be at a baseline where you're not constantly having to fight panic attacks or anxiety attacks is to expand your window of tolerance and naturally in your nervous system, in your primal body, be in that more calm, regulated state all of the time. And there's coping skills that might work, but I don't want to mislead you and say that it could work, because again, the reason anxiety attacks happen is because you can't calm yourself down. And so you start to feel a sensation of being anxious, right? Maybe that starts in your chest, maybe that starts in your belly, maybe that starts somewhere else. You start to feel that, and then you're anxious about being anxious, and then you're anxious about being anxious about being anxious, right? And it just builds and builds and builds, and it's like now you're in hyper arousal state and you can't calm down, and it's just getting more intense. And the fact that your partner is right there looking at you being like, what's going on, makes you even more anxious. And so if you had the ability in your nervous system to regulate, to come back into your window of tolerance, and again, when trauma is healed, to not even have to fight the, oh, I'm hyper aroused, now I'm coming back. I'm hyper aroused, now I'm coming back. Like you're just always in this window of tolerance of calm, cool, and chill. You have to be able to be there to not have these panic attacks. But until you are in the space where you have rewired your nervous system, you've healed your trauma and anxiety, there are some things that could work for you. So if you go on and try this, it could work, it might not. Again, we cannot rewire outside of a therapeutic relationship. And so I really do say, like, don't try this at home, but here are some things that if you're having an anxiety attack in the moment, you can certainly don't try to talk yourself into being more still. That's just going to raise the anxiety, because then it's going to be like, why am I not getting more still? Why am I not calming down? Oh no, I'm not calming down. I'm getting worse, right? So don't use those words. If they haven't helped you, they're not going to help you. Your nervous system only understands sensations and movement. And also, don't try to force yourself. Don't expect yourself to go from this anxious place to this calm place, right? That's the problem with talking about meditating, from going from this hyper aroused state to, oh, okay, I'm calm. That's just not going to happen. It needs to be a deceleration. And so if you're feeling like a 10 in your body with anxiety, you could try to like soften, like you could try to soften your body, or try to like gradually melt into more softness. Again, that just might not be effective for you if you're just way too turned up, for lack of better words. But it might help for you. I also don't recommend, I guess I'm also saying like, okay, what I don't recommend trying to do deep breaths if that hasn't worked for you. So a lot of people be like, okay, deep breaths, just take a deep breath. I've worked with psychiatric patients where that has caused more anxiety to try to take a deep breath when all they can do is like, all they can feel is the inability to breathe. So like trying to do these skills or these coping skills that that are setting you up for failure is just going to ramp up the anxiety. So it's really probably your best bet is to walk out of the space if you don't want your partner to see you. Although truly being in a healthy relationship is being able to show all of you in your relationship and not hide or not push away your partner, even when you're in an uncomfortable state. But for now, until you heal your trauma and rewire your nervous system, use that energy, that anxiety to walk out of the room, and you can walk and move in the space and then gradually slow down how you're walking, like really gradually, almost like awkwardly slowing down until you come to more stillness. You don't have to be still, but until you can like slow down your body. I actually have a video that shows you exactly how to do this. Let me know in the comments if you want me to share that with you, because it'll be more clear when you see me doing it and practice doing it. So that's a coping skill you can use for now, but obviously it's like, how many times are you going to walk out of the room when you have an anxiety attack in front of your partner, or you're getting really frustrated? How many times it's not sustainable. What is sustainable is expanding your window of tolerance and just having this new baseline of being calm, and not like, that's just so tiring and exhausting for your body to constantly have to fight anxiety. Oops, that's me. I was trying to see if there's comments here. Hey, Erica. So yeah, and medicate. So I'm responding to the comment. I now call it living in a state of simmer, which is just before boiling. Yeah, like that's like being on the edge of the window of tolerance. So some of you might relate to living on the edge all the time, where it's like, okay, well, like some days I'm cool and I'm calm, but I could explode at any moment. If you are in the Lasting Love movement, you have probably seen Let Love In alum Corey's story about how she used to just be simmering, right, and exploding a lot, and just agitated and taking that out on her family, and then going through the Let Love In process where she healed her trauma and rewired her nervous system. And she's like, my baseline is now calm. And she, like, if you search her name in the Lasting Love movement, look at her videos. She is like the essence of being in her window of tolerance. And more than that, like, she is indescribable. It's actually, there's no words. So you should just go in and look at her videos, but she just can take up her space unapologetically and calmly. And like during the Come Home to Your Body challenge, she was out in her backyard moving, and her neighbors saw her, and she just kept going and like owned it and owned her space. And there's just like such an energy you can feel from her now that she is in her window of tolerance and not pushing away her partner. And she actually used to have daily thoughts all day of leaving her marriage, because she just thought, I'm not meant to be in a relationship. I can't do this. To now being closer than ever before and not having these thoughts anymore and excited about their relationship again. So it's really a difference. I really encourage you to check out some of her movement videos. And they got amazing, like people could see it and feel it through the screen. So if you want to see the epitome or the essence of being in your window of tolerance, I definitely recommend checking her video out. And yeah, so I think that wraps up the Lasting Love Real Talk today. And if you have any questions, leave it in the comments. I'll come back and answer them. And if you are interested in going through the 3-month process of rewiring your nervous system and healing your trauma so that you can expand your window of tolerance, be calm and chill and not on the edge all the time, right? Like not on the edge of exploding, but just like you being in command of your body, of how you want to respond, of how you behave, and carrying yourself in this graceful, smooth, easy way so that you can bring all of that into your relationship and allow your partner to see you, even in moments of discomfort, so that you can become closer than before, then I encourage you to check out my program, Let Love In. It is amazing. I can share with you all the details. Anything you want to know about the program, let me know. And send me a private message or comment below if you want to know more details, and I will share all of that with you. Oh, this has been really good. I feel like it's a really good topic to talk about in a country, if you live in the US, where they advertise prescription medication on television. My cousin from Australia thought that was so, it thinks that's so bizarre. And I want you to know that you're not broken. And if you've tried healing trauma or tried calming down on your own and you haven't been able to without medication or even with medication, that it's not your fault. It's not a reflection of who you are. This is your trauma owning you. And if you are ready to release that for good, then let's have a chat. All right. I hope you know that you deserve to be able to let healthy, lasting love in. Bye-bye.